There's one common Medicare mistake that can increase what you pay every single month. And for many people, that higher cost can last for years. And I'm not talking about choosing the wrong plan. This mistake is actually much easier to make and a lot harder to fix. Because with Medicare, if you miss your enrollment window, you may end up having to pay a penalty. And this isn't a one-time fee. For many people, it gets added to their monthly premium and it stays there long term. But the tough part is a lot of people don't even realize that they've missed their window. And that's because the rules around enrollment can actually be pretty confusing. So in this video, I'll break down how these penalties work, what they can cost over time, and the most common situations where people run into this issue to hopefully help you try and avoid it. So with Medicare, many people assume that they can just sign up and enroll whenever they're ready, especially if they're still working or if they're covered by a spouse's plan. They often think, well, as long as I have coverage, I can just sign up later and I don't have to stress about it right now. And to be honest with you, that does sound pretty reasonable, because with many things in life, especially as you get older, you may miss a window, miss a deadline, you pay a small penalty, and then you just move on and adjust. But unfortunately, Medicare does not work that way. With Medicare, when you enroll can be just as important as which plan you choose. With Medicare, there are certain windows of when you're expected to sign up, and if you fail to sign up during those specific windows without a qualifying reason, it can have long-term consequences while you're on Medicare. And the two areas where this matters most are Part B and Part D. So let's start with Part B. This generally covers doctor's visits, outpatient care, and other general medical services. When you first become eligible for Medicare, you have a 7-month window in which you're expected to enroll. That window starts 3 months before you turn 65. It includes your birth month and then includes 3 months after you've turned 65. Now, if you don't enroll during that time period without a valid reason to delay, you may be charged a late enrollment penalty. And again, this isn't a one-time fee. It's actually an increase to your monthly premium. And the penalty is typically 10% for every 12-month period that you were eligible to enroll but did not. So if someone delays for 2 years, it's gonna be about a 20% increase. And if they delay even longer, that percentage continues to grow. And that higher premium stays with you for as long as you have Part B. So to highlight my point, I'll go ahead and give you a simple example. In 2026, the standard Part B premium is about $202.90 a month. If someone delayed for 2 years, that could add roughly $40 to their monthly premium. And that might not sound like a big deal at first, but over the span of 10 years, that's close to $5,000. And over 20 years, it could add up even more. And the bad part is, you'll still be receiving the same coverage this whole time, just at a higher premium. Now let's look at Part D, which covers prescription drugs. And this one works a little differently. With Part D, if you go 63 days or more without credible drug coverage once you become eligible, you may face a penalty when you go to enroll later. And the penalty is calculated at about 1% of the national base premium for each month that you went without coverage. So for example, if someone went 30 months without credible drug coverage, that could add roughly $10 to $15 to their monthly premium. And just like Part B, that penalty typically sticks with you for as long as you have Part D coverage. And because the base premium can change over time, the Part D penalty can change as well. So now you can see these aren't just small fees, they actually become part of what you pay every single month. And the longer you delay, the higher the cost can be. But here's the part where people still run into trouble. Even when people understand this, they often assume they're in the clear when they're actually not. And one of the most common traps that people fall into is when they continue to work past the age of 65. Now, if you're working past the age of 65 and you have health insurance through your employer, you may be able to delay Medicare. However, there are specific rules for this. For example, your employer typically needs to have 20 or more employees, and your coverage must be based on current active employment. And that second part is where a lot of people get tripped up, because not all coverage qualifies. For example, things like COBRA coverage, retiree coverage, or severance coverage often does not count. And even though they seem similar, Medicare treats them very differently. So when your active employment ends, you often have a limited window to enroll into Medicare. And so typically you have about a 8-month window or special enrollment period to sign up for Part B once your active employment ends. And if you miss that special enrollment period, you may have to wait for the general enrollment period, which goes from January through March. And even then, your coverage may not begin right away, which can create gaps in coverage and possibly lead to penalties. Now, there's another common mistake that people make all the time. Every year, your employer is required to let you know whether or not your drug coverage is considered creditable. And that just means that your drug coverage is at least as good as Medicare Part D. But here's the problem. This notice, often called the Notice of Credible Coverage, usually gets sent through the mail and oftentimes gets thrown out. And then later on, when people go to enroll in Part D, they may be asked to provide proof that they had creditable Part D coverage. And without proper documentation, they may end up having to pay a penalty. And here's what makes this especially important. Once a penalty is in place, it's not really easy to remove. You can't just pay it off, and switching plans doesn't remove it either. It becomes part of your monthly premium. However, there are limited exceptions, but for many people, it's something that's going to continue long term. So here is the key takeaway. Medicare late enrollment penalties are not short term. They are ongoing increases to your monthly premium. And the longer you delay, the higher they can be. But the good news is these penalties can be avoided as long as you understand the rules. So number one, if you're approaching the age of 65, know when your enrollment window starts and when it ends. Next, if you're still working past the age of 65, confirm your employer size with your HR department and make sure that your coverage qualifies. For prescriptions, ask if your coverage is considered credible. And remember, do not throw away that letter that they send you. And lastly, if you leave your job, remember to keep in mind that 8-month special enrollment window that you have. So remember these different enrollment periods, because these can be the difference between paying the standard premium or paying the premium plus penalties for years to come. Now, if you're not sure whether or not you can safely delay Medicare, watch this next video here where I walk you through when you can delay Medicare, and most importantly, how to avoid these penalties.